Well, the UK is suffering a wave of excess deaths that is not fully explained by the coronavirus, according to new statistics. Data from the Office of National Statistics showed that there were 12,050 deaths in England and Wales in the last 7 days to November 12th. That's an increase of 16.6% on the 5-year average.
Every week since mid-July, the UK has had death numbers above normal. Well, let's talk to diagnostic pathologist Dr. Clare Craig. Thank you very, very much, Dr. Clare. What's your view on where these numbers are coming from then and what the increase is all about?
Thanks for having me, Patrick. This is a problem that's actually been going on for over a year. So in autumn last year, we started to see a rise of non-COVID excess deaths, particularly in the young, and an increase of deaths in people's own homes. And the thing about people dying at home is that some of those deaths will be by choice. But it's a sort of funny choice when, if you know you're dying and you might choose to die in hospital if you were allowed visitors, but you're not allowed visitors and you end up dying at home, then that changes the statistics, but it doesn't necessarily reflect a real choice for that person. But some of those deaths at home will be cardiac deaths, and they will be deaths of people who'd never made it to hospital. And we can see that in other parts of the statistics. So since May, in particular, there's been a stepwise increase in ambulance call-outs for cardiac and respiratory arrests. And at the same time as that increase, fewer people were coming to A&E with a cardiac problem. And what that suggests, that sounds like it might be a good thing. You think, well, if we've got fewer people with cardiac disease in A&E, then maybe we've cured them. But I think the reality is that they've died. Some of these people have died and they're not coming to A&E when they would have come to A&E with more minor problems. So the excess deaths we're seeing are circulatory deaths. They're strokes and they're heart attacks. And they're much more in the young than in the older age groups. And so I think it's something that really needs to be investigated.
Some people have suggested that it might have something to do with the NHS being overwhelmed and are not able to deal with some of the pressures from other conditions because COVID is still running rampant. Do you think that rings true to the reality of what this may be caused?
So I think that when we were sold this protect the NHS idea, the reality was that the NHS shut down, and it shut down partly from policy, but mostly through fear. People didn't turn up when they should have turned up for help. And some of those people will end up with negative consequences, and it will take time for those to come through. And particularly for example, cancer patients, we're not going to see the impact of stopping screening and things like that for many years to come. It's going to carry on getting worse and worse and worse until we actually can measure the full impact that has had. Whereas for other causes of death, the impact is more immediate. And so in terms of the NHS currently, it is absolutely not being overwhelmed by COVID. That's absolutely not the case at all. It may well come under immense pressure in December, which happens every single year because we always have surges and respiratory viruses at that time of year, and because we don't really have spare capacity in our health service. And so, yes, things will get stretched. But at the moment, it's not that's causing the problem. And the problem has been going on throughout, and it carried on throughout the summer as well.
OK. Lots of people have at times raised personal concerns, whether or not these were grounded in medical fact or otherwise, about the vaccine. And last afternoon, we had consultant cardiologist Dr. Aseem Malhotra on the wonderful afternoon agenda with the even more wonderful Alex Phillips. And he raised concerns in his mind about the potential that the vaccine could have some issue when it comes to circulation and essentially heart attacks. What's your view on that?
So my view is that that these things need to be investigated, and that people have not been forthcoming with the data to allow openness, which just raises my suspicions immediately. And they have, so there's been a lack of honesty about it. And it's difficult when you're trying to assess the effect of something like a new drug, because you need a bit of time to measure things, and you don't want to accidentally assume that deaths that would have occurred anyway were due to it just because they happened in a short period afterwards. So you have to have all the data to be able to draw that conclusion. And the things that we do know that we have been allowed to find out, there's very, very good reasons for thinking that the vaccine does cause damage to the endothelium. So just the principle that there could be a problem inside the vessel linings that could affect heart attacks and strokes, that we've got good evidence of that. And actually what the vaccine, vaccine's a funny word to use to describe it, really, but the spike protein that it makes your cells make interacts with endothelial cells. So, it's actually, with many vaccines, most vaccines, you try to use an inert part of a virus. You use a bit that's the least harmful. And the spike protein really isn't that. So, I am really, really concerned that people have not been honest and open with data. But without that, we can't draw any conclusions. We can only wave our hands and say we think there might be a problem, it needs investigating, we need more data, we need more openness. One of my concerns is around deaths in young males, which have been rising since May in a way that they have not been in young females. And we know that the vaccine causes heart problems more in males. And so this discrepancy might be telling us that there's something going on. And those children that are dying, it's not in huge numbers, thankfully, but we're talking about 100 more deaths this year than last year. And there have been 483 deaths of males 15 to 19 so far this year. So 100 of them, if we had the same as last year, wouldn't have died. That's a big difference. But it's not huge numbers. It's not such huge numbers that you can't go and investigate all of those deaths and see how many of them were vaccinated, how long before the vaccination. That's not a difficult thing to do, but it has not been done.
Interesting stuff. Interesting stuff.
Wow. Thank you, Dr. Clare Craig, diagnostic pathologist.